Shingles is basically a reactivation of the chickenpox virus that lays dormant in parts of the nerves near the spinal cord for up to decades. You can't get shingles unless you've had chickenpox. You can get shingles, which typically start with a sensitivity or a pain on one side of the body, left or right, never crosses over the middle of the line. Usually followed by a rash, which is usually painful and can last a week or two. If shingles starts up, it can be a little difficult to diagnose because sometimes there's not even a rash up front. Sometimes you just get sensitivity, maybe a headache. It usually occurs on the chest, so it's typically some sensitivity and mild pain, which can progress to severe pain later. The rash, if it's present, which is usually the case, comes on later too, but in the early stages, it's frequently either missed or misdiagnosed. Shingles will more often occur if you're immunocompromised, especially patients that have been receiving chemotherapy for cancer or AIDS patients, patients that are stressed, patients that are sick with another illness, and the elderly. You see shingles most often age 60 and above, especially in the 70s, probably most commonly. We see it now and then, 30s and 40s, but not very often. So if you have anything that's stressing your immune system, you're more likely to have a shingles breakout. You have a couple treatment options for shingles, one of which is to start on medication as soon as the symptoms arise. If you do that, you can shorten the total duration of the shingles attack by at least 50% or more. And you're less likely to get the complications later, the post-herpetic neuralgia, which is the painful condition that can last a long time. The other option is the shingles vaccine, which has been available for a few years. The CDC currently recommends patients receiving a vaccine at age 60 and over, whether you've had a shingles attack or not. Shingles usually only occurs once. Only 1 or 2% of the population gets it again. The shingles vaccine, if given early, can prevent over half, around 2/3 of all the initial shingles attacks. So those are basically the two treatment options you have for shingles. And then, of course, during a shingles attack, we use medicines, not only the medicines to shorten the course of the duration of the disease, but medicines for comfort, for pain.